Hello, and thank you again for joining today's webinar. You, the United Nations, and the Sustainable Development Goals, How Sigma Nurses Can Influence Global Healthcare is the title of the presentation tonight. I am Becky Schaefer, Global Program Manager at Sigma Theta Tau International Honor Society of Nursing. Known as Sigma, the organization has more than 135,000 members in 92 countries around the world. Our mission is developing nurse leaders anywhere to improve healthcare everywhere. Our strength lies in the fact that our members are nurse leaders from all specialties, clinicians, educators, researchers, administrators, and more, from different walks of life from all over the world. We would also like to thank our panelists, who you will meet shortly, for sharing their expertise with us today. Something that we need to share with all of the attendees: Sigma Theta Tau International is an accredited provider of continuing professional development by the American Nurse Credentialing Center Commission on Accreditation. This activity is eligible for 1 continuing nursing education credit. The speakers and planning committee members have disclosed no conflict of interest. To receive contact hours for this continuing nurse education session, participants are required to attend the webcast and complete the evaluation form, which will be emailed to all attendees approximately 3 days after the webinar. Now, the webinar is being recorded and will be available on the Sigma repository within a few business days of recording. And just a quick refresher on how you can participate. At the top right of your screen is the control panel. To open and close your control panel, click the orange arrow. You're also welcome to submit your questions, thoughts, and comments via the question panel throughout the discussion. What we would like everyone to do right now is to test this feature by entering the country from which you're joining us. Please take a moment to do so and make sure to hit send so the message makes it to us. It's always nice to see what countries are represented on our webinar, so thank you, appreciate it in advance. In the meantime, during today's presentation, we'll be taking a couple of informal polls. So if you'd like to participate, please have your phone handy. We'll walk you through accessing the website as those slides come up. All right, first we would like to start with introduction of our panelists. The photo in the upper left corner is Dawn. So would you like to start, Dawn?
Hi, good evening, everyone. I'm Dawn, as Becky said. I am a registered nurse and a family nurse practitioner. I am one of the Sigma Youth representatives and part of the Alpha Zeta chapter here in New York and Region 14. And the sustainable development goal that resonates the most with me is SDG 10, which is reduced inequalities.
Janice?
And I'm Janice Hawkins, a UN liaison as part of Epsilon Chi chapter. I'm coming to you from Chesapeake, Virginia tonight in Region 13. And I think the SDG that's a good one to highlight tonight is actually SDG 2 for Zero Hunger, because next week we're celebrating World Food Day.
Thank you, Janice. Arik?
Hello, everyone. My name is Arik Shimmick. I live in Chicago, Illinois, where I work as a pediatric nurse. And I'm serving as one of the United Nations liaisons. And I'm pretty passionate about SDG number 1, which is about no poverty, simply because I think that is truly a root cause for many of the issues we face as nurses.
Dania, please introduce yourself.
Hi, I'm Danya. I am a practicing registered nurse and a family nurse practitioner student. I am part of the Iota Eta chapter, which is in Region 2. I am also, like Dawn, one of the UN youth representatives. I am most passionate about SDG 17, or Partnerships for Goals, because they can really only be achieved with inclusive partnerships at the global, national, and local levels.
Thank you, Dania. Valerie?
Hello, I'm Valerie Clary Miranda from the Delta Road chapter of Sigma in the Eastern Region in Philadelphia, Pennsylvania. I'm an assistant professor at Thomas Jefferson University College of Nursing. The Sustainable Development Goal that I'm most passionate about is SDG 3, and that's good health and well-being. And this may seem like an obvious choice, but the reason why I'm passionate about it is because this SDG is linked to all the other SDGs in some way.
And the last photo is Penny Sessler Brandon. She is located out on the East Coast right at the moment and is encountering a rain and windstorm. So she continues to try to log on, but she is a valuable member of the team and is one of our United Nations liaison. We will go ahead and proceed now that we have finished with the introductions. And next slide is where you start, Eric. You have the floor.
All right, thanks everyone. Again, thank you so much for making the time to join us tonight. And it's really exciting to see so many people in such a wide variety of locations around the world. So thank you. We just wanted to start today with a couple of key messages of what our presentation is hoping to do. I think the most important takeaway from this is we just want this to be something that starts the conversation. I think a lot of us come into nursing because we want to help people. And I think especially during the pandemic, we've really felt in some ways unable to do that. And I think this might be an interesting way for both you, your chapter, and your employer to look at how we take something that seems very big and global, but make it happen down at the local level. This is also a really great way to energize your chapter with new activities. We're hearing some great stories of people who are trying things that have never been done before at their chapter and really seem to be of interest to the students and the members of that chapter. So, but we're really here today just to kind of explain what we do, why we are at the United Nations. I'm going to talk a little bit about what the UN is. And then, like I mentioned, how do we get this from this big kind of global idea down to what I do every day at work. And lastly, then just to give you some ideas of how you can connect with Sigma, the UN team, and also the UN itself. Next slide. All right, so just to kind of level set with everyone, and this is one of my favorite slides. I like talking about history for some reason. But the UN, just to give everyone a basic understanding of what it is in case you don't, it is an international intergovernmental organization which was founded in 1945 after World War II. It's the world's truly only international global organization. It is made up of 193 member states that all participate, and they have a couple of headquarters. The ones that are most well known, I think, are New York and Geneva, but they also have headquarters in Vienna and Nairobi. So really the UN is focused on making the world kind of a better place. And I know that sounds a little cliche, but their job is really to focus on the things that no one country can handle by themselves. So whether it's protecting international law or promoting the right kind of development or delivering humanitarian aid, these are things that often lie outside of what an individual country or government can do. And that's where the UN really plays an important role. Lastly, I'll just mention there are 6 main branches of the United Nations, and the one that we belong to is called the Economic and Social Council, and we'll talk a little bit more about that later. Next slide. All right, so you might be wondering, and maybe this is part of what brought you here tonight, but why does Sigma participate at something like the United Nations? And I think really the best answer is we're at the UN to represent you and all of the work that you do every single day. We are here to fulfill our mission of Sigma by representing health and nursing and really the voice of the nursing leadership, which really sets us apart as a unique viewpoint in the world. We're also there to kind of lend our strength and our numbers to achieving some of the goals of the United Nations, and then to just really make sure that we're offering opportunities to our members at many different levels of things that they can do in their own life. And, you know, especially for things like career development, it's very important to have a unique thing on your resume or a unique project for your master's degree, for example. So those are kind of some of the key reasons that we participate. But I think before we move on to the next slide, I just would mention that really, whether we see it or not, I do believe that every nurse is an advocate. And it is our chance at the United Nations to advocate very broadly for the things that are important to us and to the people that we serve, and also to elevate our profession as something that really is one of the most important parts of modern day healthcare. Next slide. So as I mentioned, we do belong to the branch of the UN called the ECOSOC, or Economic Social Council. Excuse me. We have special consultative status with them, and that gives us the opportunity to attend events in New York. We also can attend presentations globally, and we can provide oral and written statements and really participate in any kind of activity or meeting as a representative of healthcare and the nursing piece of healthcare. We're also given the chance through our membership with ECOSOC to build partnerships really among like-minded people. So other nursing organizations, other medical organizations, or perhaps just other organizations that are important in certain regions where our Sigma members live. These are all really great opportunities for us to join forces and make sure that our voice is loud and echoed through as many chambers as possible. Next slide. All right, so just a quick overview of some of the things that we've done in the last, I'd say, year to 18 months. As I'm sure you know, through most of this year, the United Nations compounds have been closed to visitors. So most of our stuff has been either virtual or in the form of written statements. But previously, we were able to attend things like the Commission on the Status of Women, which happens every March in New York City and brings together about 80,000 people. So it's a wonderful, wonderful event for us to talk about the role of women in the world, as well as how women change the field of nursing. We've also been able to join things like high-level meetings on universal health care. We were there to help celebrate the International Nurses Day in May. We've read written statements at different high-level political forums, and we attended the launch of the World Health Organization's Global Action Plan for Healthy Lives. Down at the bottom there, we do have our link for the virtual events. These events are available to you. They're available to anyone who's interested. You can go to that website and search by subject or team within the United Nations and find something that you might be interested in. Next slide. Couple more key events here. We did participate with JPIGO in a webinar presentation called What Do We Teach Our Daughters? Nurses, Women, and Prosperity. That was a great thing to be a part of, and JPIGO is a really great friend to us and advocate alongside of us at the UN. We've also recently begun really getting involved in some publishing of articles and thought pieces to just express some of the great work that you guys are doing and how nurses are taking a lead in many of the things that we're facing today. And that has included both articles within the Sigma global family and the American Journal of Nursing. Next slide. All right, so this next slide, we're going to ask you to participate. So if you have the ability, we would love to have you join us. To do this, you would need some sort of web browser, which is probably what you're in now. So if you want to use your mobile phone, if possible, or maybe another window of the same browser, go to www.menti.com, and we're going to ask you to enter a code. And this will allow you to answer the questions that we put up on the screen, and you'll see the answers populate from all the attendees around the world. So the code we're going to use tonight is at the top of the screen. If you can't see it, it is 348993. So go ahead, go to that website and enter 348993 and let us know which of these activities sound really interesting to you, both as a member and maybe as a chapter leader. Things that we really could focus on in the coming year to get you more engaged in what the UN does and what we do there. I'll give it a couple minutes for things to keep loading. I'm impressed. So far, pretty even. This is great. All right. So I won't read off the results because they will continue to change. And also the text is very small on my screen and I can't find my glasses. But I will say that, again, it's very impressive and interesting that these 5 options have almost equal representation. These are 5 really great ways that we can engage with you and your teams. And this is something that we'll take back to our planning committee. So thank you for your input. Next slide, please. Also, don't forget to mention, if you needed a little bit more time, we will still collect those answers as you put them in. So even if we've moved on, don't worry. We will have that in our final presentation and for our planning committee. This, couldn't resist the chance to throw in a couple of fun pictures. I think fun is the best word to describe what it's like to go to the United Nations. It is an incredibly interesting and stimulating place full of some of the most amazing people. And we've had the chance to do a little bit of everything. It's been fun to be inside the compound, but also to meet allies outside of the compound for meetings and side events and parallel events and things like that. So a couple of our pictures here, you'll see included in the picture in the bottom middle is Connie, who is she's transitioned out of her role with the United Nations liaison team, but she was here for a couple of years beforehand, and she was a great resource for us as we continue to work at the UN. Next slide. And so this one, we really wanted to just call this out because I think it is very important. And this is, as I'm sure you can imagine, one of the most nerve-wracking things that a person could do. As someone who does not care for public speaking, this is a challenge, but that is what we're there to do. And in certain meetings, we have the opportunity to either ask questions or to read statements. And so you'll see Connie, myself, and Danya in these 3 pictures really getting the attention of the leadership to ask questions about nursing and why aren't nurses more at the table. And I just want to call out Danya because I love this picture in this moment. She was actually asking a question to the head of the World Health Organization. So your membership and your team at Sigma really is talking to people at the very top of the food chain. Next slide. All right, this is my last slide. I'm sure you're tired of my voice by now, but we couldn't also go on without mentioning that this is, of course, the year of the nurse and the midwife, which I think is kind of poetic and fitting at the same time as it is frustrating, because as I'm sure you feel, we have not really been able to celebrate and to acknowledge the work that you guys do as much as we would like. So this is a chance. Again, 2020 is, is the 200th anniversary of Florence's birthday. But we really just want to make sure that people are taking a moment in your life and with your teams to step back, give thanks, acknowledge someone who's really gone above and beyond, and try to make 2020 still a fantastic year for all of us. Next slide. And I will hand it over from here. So thank you very much.
So this is a list of all of the 17 SDGs. They're very interactive, easy to read, easy to understand, very eye-catching. But the SDGs are definitely a blueprint to achieving a better and more sustainable future for all. They address the global challenges we face, and especially with COVID and the global pandemic that we've been having, they've been even more in the spotlight because it stresses just how important now more than ever that we do need to achieve these SDGs. So please take a moment to look over all the SDG icons and think about the top 3 that you're most passionate about, which we kind of did during our introductions. Keep those numbers in mind because we want to hear your opinion in the next couple of slides, because this way we can kind of interact with you guys, see what kind of material we can send out, how to engage you guys better, and go from there. So we can do next slide, Becky, whenever you're ready. So oftentimes, one of the biggest questions that we get during meetings or just at the UN and nurses is they're always curious as to what the SDGs actually are. So in short, there's 17 global goals that also include sub-goals, so a total of 169 targets that were adopted by the UN in 2015. They definitely cover a broad range of issues for our world, including health, poverty, climate change, gender equality that we hope to achieve by 2030. So 2020 was the mark of the decade of delivery. So we're really hoping in the next 10 years we really gain more momentum towards achieving it, because we want to be more than where we are now. So with your guys' help, we can definitely help progress that. So SDG 3, which you guys might all be familiar with, is good health and well-being. It aims to ensure healthy lives and promote well-being for all. And then health and nurses all play a key role in achieving the 17 goals. Like Valerie said earlier in her introduction, they're all interconnected and nurses are right at the center. Next slide. So this is similar to the last poll that we guys did. So if you guys still have Menti open on your phones, if you don't, go back, click into it and put in the code. It was 34, 89, and 93. You guys can go ahead. We tried to kind of make it a little bit easy for you guys to see, but if you can write which 3 SDGs you are most passionate about. Try to include the numbers if possible versus the word. Loving seeing all the wide variety. I thought everyone would put 3, but it's really good to see that you guys are passionate about many different global challenges, or global opportunities, should I say. Awesome. Thank you guys so much for participating. Whenever we're ready, we can go on to the next slide. So why should we, as nurses, care about the SDGs? Like we said earlier, we are definitely the key to achieving the SDGs because we work closely with communities, especially vulnerable communities, and we're critical towards empowering individuals to be advocates of their own health. You know, nurses as primary providers of healthcare and advocates are definitely essential. We are that crucial link between the community and healthcare system. Oftentimes we're patients' voices. We have that moral imperative to advocate for positive change. And I always like to say that, you know, it's our world, our health. We all share one planet. So the change and the momentum that we do towards dedicating towards these goals will help just make the world better for you, for your family, and for your community. And always, you know, we always like to encourage you to celebrate your achievements. Share your stories with us. At the end of the webinar, we'll have our emails and ways to contact us. We would love to hear how you're impacting your community. And as always, use your voice to lead. It doesn't have to always be global. It can just be hosting a chapter meeting, sharing something with your coworkers at your hospital. So there's so many ways that you can share about what you're passionate about. I'm gonna pass it on over to Dawn now.
Thanks, Danya. So as Danya was saying, the SDGs provide a global blueprint to promote what I like to call the 5 Ps, people, planet, prosperity, peace, and partnership. These 5 ideas are interwoven throughout the SDGs as a way to describe the world in which we want to live in and in what condition we want to hand it over to future generations. And, you know, for me, when I first got involved with the UN and began to learn more about the SDGs, I started to feel very small. You know, how can I as an individual affect some of these large and lofty goals? As I got familiar with them and then dug in, I started to realize that the beauty of the SDGs is that there isn't any one way to achieve them, and that individual, local, community level buy-ins is the best way to scale global change. For example, as nurses, we know that social and physical environment is a critical link to health. There are so many ways in which we can support our communities through that knowledge. Some that are obvious, such as advocating for decreased pollution that affects childhood asthma rates, and some that are less obvious. For example, in the US, data shows that communities who vote in higher numbers are more likely to be healthier. While many different factors go into this data, like wealth and education, the bottom line is that communities that are more engaged can make their voices heard and advocate for themselves about what they need. Like a ripple effect, positive change can scale quickly and change outcomes. Next slide, please. So to try to understand how we translate the SDGs into nursing actions, we thought we'd highlight a specific SDG to give some examples of ways nurses can create change. So Sustainable Development Goal number 5 is about achieving gender equality. I think to understand what gender equality is, we need to frame it by what gender inequality looks like. Gender inequality manifests in every aspect of women and girls' lives. Data shows that women are less likely to hold advanced degrees, occupy positions in government or as CEOs, and are consistently paid less than their male counterparts. In contrast, women are more likely to experience violence from an intimate partner, be expected to perform unpaid domestic work, and be married before the age of 18. These inequalities drive huge barriers to achieving gender equality and has enormous socioeconomic ramifications. We have long known one of the best single best ways to fuel thriving economies is the empowerment of women. The UN recognizes this vast importance of gender equality, and in efforts to change, they've set forth several targets and created a UN entity called UN Women, specifically dedicated to gender equality and the empowerment of women. Next slide, please. And as Danya mentioned, it would be impossible to speak about the SDGs and 2020 in general without also speaking about the pandemic and some of the setbacks faced due to COVID-19. So I like this graph because it kind of shows 3 main issues that the UN is trying to address due to the setbacks that COVID-19 have kind of set forth. So before COVID, there were promising goals being reached, such as fewer girls being forced into early marriage and greater representation of women in leadership roles. However, the pandemic has exacerbated many of the existing problems. I'm sure many of you have heard domestic violence cases have risen up to 30% in some countries. It has been called the shadow pandemic due to focus being pulled elsewhere. This rise in intimate partner violence makes sense as individuals are shut in their homes, often with their abusers, cut off from typical resources like friends, families, or healthcare professionals. Additionally, women are also bearing household burdens during the pandemic. Before COVID-19, women already spent roughly 3 times the amount of time doing unpaid domestic labor. These domestic tasks have historically been gendered and rarely recognized as work, even though it subsidizes the cost of care that sustains families, supports economies, and often fills in for the lack of social services. Pandemic-related lockdowns and school closures have increased the workload, specifically affecting women who traditionally fill roles of childcare, domestic work, and elder care. These increasing domestic workloads affect women's abilities for career and education advancement. And of course, as I'm sure many of you have experienced firsthand, women make up 70% of healthcare and social workers, putting them at increased risk for infection and trauma related to being frontline workers. As I go through all these, I think these issues can feel very disheartening, but I also think that it's an opportunity to reframe gender equality and highlight major issues that need to be tackled. So just some of the few ways that we thought of way to incorporate the SG5 into nursing actions, and this is not an exhaustive list, is to utilize the nursing workforce. So women make up 90% of nurses and are in unique positions to promote gender equality by supporting colleagues in pursuit of leadership positions. Nurses are also in the unique position to advocate for increased screening for IPV in your workplace and provide support networks and options. Nurses can also seek out training for yourself and for others about warning signs of sex trafficking. If you choose to be an advocate or to create initiatives, you can be inclusive in your language and acknowledge compounding effects of other inequalities such as racism, gender identity, and sexual orientation discrimination. and you can ensure that access to sexual and reproductive education and health is available. And finally, you can share ideas and collaborate with your nursing network. Nurses and midwives are roughly 20 million strong, which is a huge number worldwide, and there's a lot of potential in our collective voice. Next slide, please. And before I hand it over to Valerie, I'll just finish by reading this quote from former Director General of the World Health Organization. Nurses respond to health needs of people in all settings and throughout the lifespan. Their roles are critical in achieving global mandates, such as universal health coverage and sustainable development goals. I'll turn it over to Valerie now.
Thank you, Dawn. So you might be asking, how can I be a voice to lead? So change and impact starts with you. Nurses are already out there doing a lot of things and leading a lot of efforts. There are many ways in which the health and the well-being of people can be enhanced and improved. Every nurse has a voice, and we can use that voice to make a difference. At every level of nursing practice, nurses have a significant role to play in achieving the SDGs. Next slide, please. Next slide. Can you get a minute? Thank you. So in terms of individual participation, never underestimate the power of small, thoughtful, and deliberate actions. So we can search. If you're looking for ideas, you can search the website, look for keywords, look for things that are of interest to you. You can find a program where you can use your talents. You can volunteer. You can volunteer your time to make a difference. And every worthy cause needs resources. So you can donate your time, your talents, your resources to worthy causes. And you can also become a chapter champion. And you can bring some of those great ideas to your chapter for implementation of projects that lead towards achieving the SDGs. Next slide, please. So as a chapter champion, you want to make sure that you use chapter resources to do what you can accomplish by yourselves. So we can sponsor a health-related event in the underserved area, start a mentoring program, partner with a hospital or clinic to help create a health-related campaign. You can assemble care package to be sent to areas in need. Those areas could be around the block, they could be across town, or they could be on the other side of the globe. You can volunteer in schools to educate PTO members, students, faculty, and staff. And you want to make sure that you include those SDG related activities in your chapter's annual report. Don't forget to do that. Next slide, please. So here are a few excellent examples of how chapters are already working towards achieving the SDGs. The Ada Road chapter has helped create an American-based nursing curriculum in Myanmar and sponsorships for students to study abroad in the United States. So the SDG quality education is directly connected to those efforts. The Pi Omicron chapter has contributed towards the SDG No Hunger by providing volunteers at local food pantries and educating the surrounding communities about wellness and issues associated with food security. The Omega Kappa chapter has worked towards achieving the SDG of good health and well-being, my favorite, by implementing the recovery model in community mental health centers in developing countries. And the Gamma Tau at Large chapter has worked towards achieving the SDG of life below water by promoting a coastal cleanup month and encouraging individuals and families to participate while keeping the community safe with social distancing. Once again, nurses taking the lead to create change. You might find that your chapter is already doing some similar projects. If so, we want to know all about it. Next slide, please. So this leads us to our next polling question. So what activities are you doing at the local level to impact the SDGs? Wow, we have a lot of awesome ideas here. We have health fairs, voting. We know how important that is. Pivoting global health research, collaborating for training, health fairs for veterans, volunteering at homeless shelters. These are all awesome ideas. Urban gardening, I like that one. Awesome. Well, thank you once again for participating in our poll. And now I will pass the baton to my colleague, Janice.
Thanks, Valerie. These definitely are interesting as they scroll down. And we'll be able to take a look at these earlier. I'm definitely interested, though, in what diffusion means. So maybe whoever wrote that can write us a little note in the question chat so we can learn more about that. Next slide, Becky. So one thing we wanted to do before we left today is make sure that we share some resources that you may already be familiar with. Certainly, a lot of you mentioned a lot of great activities that you're engaged in, so you may be very familiar with some of these sites. The first one to mention is a website, Global Citizen, and on this website, several of you mentioned voting as an activity to do. On this website, you can also go and engage directly with your Congress members. So if you're interested in letting your representatives know how you feel about a certain issue, you can go to the site and plug right in and have a pre-scripted letter to send or a petition to sign. Other things you can do on the site is if you like quizzes and tests, or you like to score points and earn credits and badges on the site, you can take tests to promote your own awareness. There are social media kits on the site, so you can go in and find some text or pictures and graphics that you can share on your social media outlets to promote awareness. Another thing that you can do that maybe several of you have already done is take an overseas trip, of course, when things open back up. But many of you may be deployed to support COVID and went to areas of high need that were closer to you, but where COVID more impacted the community. But we feel like when you take a trip overseas, and particularly if you can engage in a trip that is related to healthcare or health promotion, you become a lot more aware of some of the global needs. Another thing you can do is check with your local service organizations for global outreach projects. For example, Rotary International has been engaged since 1979 with polio eradication efforts, and since 1979 we've reduced polio globally by 99%. So that's something you can get involved with your local chapter to make a global impact. Or another example might be Lions Club International that collects eyeglasses and recycles and distributes those. So lots of things that you can do along with the list that you guys mentioned, that things you can do locally. I noticed somebody commented about food pantries, and that was a SDG that I mentioned earlier with Zero Hunger. 45% of produce and vegetables are wasted each year. So 45%. So that's an area that we can impact just by being able to reuse some of those and decrease that waste. Next slide, Becky. So we got another list. We could have done just slides and slides of resources, but we did realize we had to stop at some point tonight. But this is another slide of just things that you might be interested in. We mentioned the UN website earlier. Arik gave you kind of a brief history and overview of that, but you can go on the site to learn more about the UN in general. You can also go to the UN site to learn more about the SDGs. There's a breakdown on the site of publications related to the SDGs, what the targets are for each one. So if you're not already familiar with those, it's great to look at those goals. Those goals will really give you ideas of things you can do in your chapter too, because you can target a specific goal and really break those down even further. You can, I noticed somebody mentioned they're teaching classes as part of a way to promote the SDGs. So you can grab some resources from this site and even use some of the archived briefings to spark discussions in your classrooms or perhaps in your virtual classrooms right now, but there's a lot of great resources on the site to use. Sigma has a site too where you'll find more about Sigma's global initiatives, including the Nightingale Challenge to develop global nurse leaders worldwide, and also more information about your UN liaisons and the work we do. You'll find our reports on the site, and maybe even some of the same pictures that you've seen tonight are there. Another resource on the Sigma site is the Find Your Forward website, and on that you'll find resources to promote advocacy for nursing and to help impact change for healthcare. So just good ideas and things you can do there. A really fun one for those of you that are real savvy with your phones, which judging by your ability to navigate Mentimeter, I think you probably are. So you might like this app, which is the SDG in Action mobile app. And behind each SDG, you'll find more information on that SDG. You'll get newsletters through that app. So that's just another thing just to have handy on your phone if you want to download that app from the App Store. Next slide, Becky. More resources to share with you. The activity reports I already mentioned. Plan a visit. I noticed almost 25% of you mentioned that you'd like to take a tour of the UN site, or maybe that was 25% of you that had taken that tour. So when we get an opportunity, I've definitely, it's been disappointing this year that a lot of our events have been online. We certainly had plans to go to the CSW and have our site event, which Arik and Dawn still presented as a webinar. So thankfully, the good news is that a lot of people can attend, but we certainly look forward to when we can be on site again at the UN building and be a part of some of the Sigma sponsored site events that some of you mentioned as things that you've attended before. Take a look too at what GAPFIN is doing in their report that you'll find on the Sigma repository. And as Donnie asked you earlier, share your stories. You can email them directly to this site. You can apply to the Nightingale Challenge, or you can apply to serve in the same role that we're doing, which certainly will get you engaged and opportunities to learn from each other, to plug in with other leaders and others that are interested in global health and activities of the UN liaison. Next slide, Becky. And this is the last resource that we mentioned that we hope you'll take advantage of. Is actually is to invite us to come speak at maybe a regional conference or a chapter meeting. We would be happy to engage with you. In fact, Dawn and I will be speaking at the Region 14 regional conference is coming up November 15th. So hopefully some of you that are in Region 14 will be able to meet with you again there. So these are our email addresses. Please email us, contact us directly. You'll find these also on the Sigma site if you don't have to write these down, but also these resources in this presentation will be available to you in the Sigma repository, so you can access this again even after tonight. So now what we'd like to do, next slide, Becky, is we'd like to open it up for questions. If you could use the question in your webinar, if you could use the question box and type in your questions, and we're going to monitor that, and hopefully as a panel we'll be able to respond to some of those. And while we're waiting on those questions to come in, one thing that's neat on the UN website is they highlight an SDG of the month. So the SDG of the month, I'm in my global health class that I teach at ODU, the leading cause of death in Syria is actually bombs and missiles. That's the leading cause of death. And in the last few, and probably the last 5 years, their life expectancy for that country has dropped because of the civil unrest. So certainly all the SDGs are linked back to Valerie's favorite one, SDG number 3. Since I don't see any questions coming in right this minute, I'm going to ask any of the other panelists if they want to highlight something that we didn't get an opportunity to share during our brief few minutes.
I actually have some questions that have come in, Janice, if no one else wants to jump in right yet. So the first question I have is from Kathy. She says, "This is so timely, thank you. I plan to address in my community class. Do you have some suggestions for engaging activities?" I know that we have some fellow educators here on the panel, so maybe they can answer those questions.
I'll answer that question. There are a lot of things that you can do. One of the projects that my chapter, Delta Rho, has done, we actually created kits for feminine hygiene for area school children, and we adopted one particular school in Philadelphia that we work with. And we created these kits because it was identified by the school as a problem and something that needed to be addressed. So that's one of the things that we've done. And we've also done different types of care kits for shelters that are in the area. And a couple of high schools and middle schools have like a closet where students can get like deodorant and clean underwear and things like that, things that you think that you would take for granted, that you would think everyone would have access to. But there are some children with unstable housing that don't have access to these things. So, and you might also want to think about like looking at the challenges in your surrounding area and see if you can come up with a plan to address some of those.
We've also created a handout. I think all of our team got together and we created a handout for chapter and local ideas for every SDG. So what we hope to accomplish with this webinar too is to just kind of teach you guys or kind of inspire you guys to develop an SDG mindset. So you see this problem, you try to connect it to a global goal, and you get, you get talking with other people in your chapter or your work of plays and figure out how you can accomplish it. And that handout is available on our website. So if you go under Sigma Global, it should be attached. So it's great. And then that app that Janice mentioned is great too, because not only does it talk about why it's important, it gives you examples. So sometimes it's hard. You can feel like it's a huge thing that we're going to tackle, but small steps lead to global change. So that's a great resource for you guys.
Great, thanks guys. The next question I have is any suggestions for trips overseas? Maybe private chapters do these, but perhaps other ideas?
I know for me, I was part of an organization named SAMS that did medical mission trips for refugee camps. So I've gone with them about almost 10 refugee trips, so mission trips in countries that are affected by that crisis, providing care. So although it would be really like, I would love to hop on a plane tomorrow and help, sometimes it's really hard when we have a lot on our plate. So you can help spread the word about these organizations. You can donate, you can collect resources. If your hospital, for an example, wastes a lot of supplies when a patient gets discharged, you can collect that, and they would be more than happy to take that overseas to put it to good use. So there's so many ways that you can get involved.
Can I also jump in just for 1 second? I wanted to also mention tonight that the United Nations Association of the United States, and forgive me, I think every country has one, but ours here in the US is in New York. And they do a lot of individual chapter ideas and efforts that can really be scaled across a very large institution. So some that come to mind are like, I think it's Nothing But Nets or Shot at Life. And they're really promoting the idea of like immunizations and how we use mosquito nets to avoid some of the common maladies around the world. So there are things that even though, we have that kind of focus of like, let's go somewhere and do something, I think there's still a lot to be done right now, just from the comfort of your own home and from your own organization. As you look at some projects like that have really great toolkits I've got things really well laid out, and I just want to mention that as another United Nations resource that isn't Sigma related, but is also there for you.
Can I add to the like the Shot at Life, for example, to even address the question for teaching? Shot at Life has a fantastic advocacy training program, and is something that I've plugged my students into, so it helps them build skills to be an advocate. I think our students are really associate advocacy with kind of bedside advocacy, and the thing that they're not as aware of how to be an advocate for the communities we serve. So it directly links to reducing inequalities. With 1.5 million children around the world still die from a vaccine preventable disease. So with the Shot at Life Foundation, they can learn advocacy skills, and those are transferable to really any other issue that they may want to get involved in. So what I really like about it is that it's pre-built for you with just how do you write your congressman, how do you send out an appropriate tweet, how do you write a letter to the editor. Just some really great resources to share with students and to use yourself.
Great. The next question we have is, I'm wondering what or how we can begin to shift our focus to more capacity building efforts in sub-Saharan Africa. I find that many of our aid initiatives are oftentimes crippling to the local community. I think that that's it's a very interesting question. And I think that that is something that, the UN is also interested in, and trying to provide aid while at the same time building it with the local community, which I think is kind of in one of the answers, is being able to not just come in and say, we're going to provide this aid and just one sweeping try to fix all solution, instead trying to build relationships and I would even say partnerships, SDG 17, with the local communities, and trying to understand what it is exactly that they need, and not just say, here's the thing that we have and we decided for you, instead building those solutions together.
Hence the word sustainable development goals.
I just wanted to add that, we have chapters and we have like members that are part of at-large chapters in sub-Saharan Africa. So one of the things that you might want to consider is to reach out to some members in that part of the world and see what some of the issues are, because the people on the ground, they know the issues more than anyone else. So you might be able to actually create a project that might be impactful by doing that. So that's a really good question. And it can be pretty tricky, but that is one approach that you might want to consider.
And you can continue the discussion on the circle too. And that way more people can be engaged that necessarily aren't on this webinar call, that are interested with the same exact or similar interests.
Great. The next question I have is from Sally. She's currently working in active duty Navy nurse station in Norfolk, Virginia, as part of the Iota Alpha chapter in New Jersey, and was wondering if we had any suggestions on how they can get involved with my chapter from here. Thank you everyone for a great presentation.
I think you can join any of the at-large chapters too, that target to people that aren't necessarily maybe, or you can talk to your chapter in itself and see how you can engage with them. You can talk to your region director, you can talk to chapter leaders, you can talk to us. Maybe we can try to connect you, or we know somebody at your chapter that we can kind of initiate that discussion for you.
I just wanted to add that a lot of chapters are meeting remotely now. So you might want to see if your chapter is indeed meeting, and perhaps you are able to join some of those meetings.
And thank you for your service, by the way.
The next question I have
I feel like I should chime in. I feel like I should chime into her since we're neighbors. I'm here in Chesapeake and she's there in Norfolk. I was gonna add that I think there's a lot of opportunities. Even the conference for Region 14 this year is going to be remote. But I think one way to get involved, even at the Sigma level, is to plug into some of the circles. So I get emails every day related to circle events. Are related to conversations in the circle, and a lot of times they connect you with events that are happening locally.
The next question we have is, if I'm an SDG promoter, how can I share my actions with Sigma? Arik, you want to take that one?
I was going to say, if I'm thinking how I want to phrase this, but the point is, if you can think of it, do it. If we can hear about all the great stuff you're doing through social media, or you want to send us an email, or you want to invite us to, just participate in your presentation, or send us the presentation slides after the fact and just say, this is an example of something that we're working on. I think and I love the slide that was in Valerie's section where they're talking about every chapter. In many cases, people are already doing things that relate very easily to the Sustainable Development Goals. I don't think as nurses, we always do a great job of talking to other people outside of our profession. I think we do really well communicating amongst each other, but now's the time to take some of this great work that we're doing and really let people know. So letting us at Sigma know is one of the easiest ways for us to be kind of equipped with this information so we can go out and sing your praises.
Absolutely. And I would say, we love to connect and interact with everyone and hear what people are interested about as far as the Sustainable Development Goals and the actions that you're taking. So even if you wanted to email one of us, and then we can try to condense the information and even present on it the next time we do a presentation, just to show all the great work that everyone's been doing.
And like I always say, celebrate your achievements, share your stories, and use your voice to lead.
The next question I have, when people entered their interest, SDG 13 was very prevalent. How has Sigma embraced this goal, and what can we do as members to elevate that as a higher priority for the organization? And just so everyone knows, SDG 13 is climate action.
I can jump in to get us started here. I think one of the biggest benefits that I see from my membership in Sigma is just the ability to meet people that I probably wouldn't have interacted with, but who share a lot of the same ideas and goals. So when we have a group of people who are nursing leaders in their own areas around the world, when they come together at things like convention or the research event that they have, or any of the Sigma events, it's really a chance for everyone to come together on things like climate change and talk about how they can join forces, or maybe what's worked and what didn't with their student populations. As I'm sure you can imagine, every chapter is incredibly different. So at the end of the day, we want to do something that is appropriate and meaningful. And I think sometimes hearing what maybe hasn't gone so well for other people kind of will spur the idea of the direction you want to go. But I think to kind of answer your question, I just think that our ability to communicate and interact with each other as members of Sigma is really an important piece of how we get things like climate change to move in the right direction.
Earlier this year, American Journal of Nursing published an article of an initiative that nurses started at a hospital to save waste. And just like 5 hospitals locally, one of the big initiatives they did was reduce linen usage. And it really was a big culture shift to, we're used to stocking linens in the room, and really just to shift with the nurses to show how much waste was going on. But I don't remember the numbers, but the waste that they saved was just remarkable, and it was a nurse-led initiative. So Sigma, we're all nurses. That's one thing we can do. And then to come back around to the circle, one of the conversations this week is about how to infuse climate change into undergraduate nursing education. And a lot of nurses in that conversation are sharing resources and articles and ideas to just how to incorporate.
Great, and I see just a couple people were asking about where the handout was, and I think that's the one that Danya was talking about, and that's actually right on the Sigma website. If you just Google Sigma UN and then that home page, you'll be able to navigate straight to the handout. We actually have quite a few more questions, but I know our time is running short. Becky, is there a hard cutoff at 8? I want to be respectful of everyone's time, of course, but we do have some, looks like great questions still.
They're welcome to direct their questions to any of you as well. If that would be helpful to them, they can start the conversation on the circle, as you've mentioned as well.
Great. Why don't I do just 2 more questions, if that's okay with the other panelists, and then we'll ask everyone else if the questions that we didn't get to just email us with some of the questions that you have, because I see that there's lots more and they all look great. So this next question is, there are limited resources during COVID-19. How do we address SDG concerns in this time of pandemic? I think that that's something that's very central to the UN right now. I think everyone would agree it's something that they've been trying to deal with, because honestly, like I was saying with SDG 5, a lot of the targets and goals of the SDGs have had a lot of setbacks due to COVID-19 and just the cascading effects of the pandemic. One thing, if you're interested in seeing what the UN is doing a little bit further, is under each of the SDGs, they also have kind of a little box that talks about specific COVID-19 goals and ways that they're trying to get back on track in light of everything that's happened. Arik, I know you had also sent us all a really good article, and if you want to talk about that briefly, about COVID-19 and just kind of at the local level that people need to be getting involved as well, not just at the national and global level.
Yeah, I think the article, and forgive me, I forget where it was published, but it was related to what kind of we're talking about tonight, and that is, how do we get nurses to really take a larger role in promoting these SDGs, but obviously understanding that we all have lives and we all have work and other things that can interfere. So in this time of maybe limited movement and limited social engagement, I've heard of a lot of people taking the chance to, to study up on a particular item that they're really passionate about. Or Danya, I know you've mentioned things of like a single person doing their own beach cleanup day. And when we have 60 of those happening on the same day, even though it's a socially distanced event, you can still have a major impact on the environment. So being where we are today and having limited resources is definitely a hurdle. I think looking for organizations and teams that have toolkits that are already built can kind of keep the energy moving and keep building through this. Here in Chicago, we're about to head into the snowy part of the year, and I know it's a really great time for me to catch up on my reading and to do things online. So if you don't have Zoom fatigue yet, I encourage you to continue working online and connecting with us and connecting with people around the world, because I think that helps our ability to kind of get through this and maintain mental health as well.
Great. A lot of these other questions are asking kind of specific things that we had mentioned prior, or asking for links to resources, or actually one is asking for our emails again. So I was thinking that we'll post our emails again. Our emails are also on the webpage at UN Sigma. And so you can go to there, or we'll post them up here as well, and email us with any of the further questions that you guys have.
Well, then why don't we wrap it up for the evening? I want to thank all of our presenters today for this great information. We certainly appreciate it. We are grateful that you took the time to share with this audience. As for the attendees, we hope you enjoyed the webinar. Be sure to check out Sigma's upcoming webinars and podcasts and resources to support you and your colleagues at sigmanursing.org. All of our previously recorded webinars and podcasts are freely available on the repository as well. So this webinar will also be downloaded. We'll be sending out a link so you can access it and look at the answers, some of the examples. You'll have the email addresses. So make sure to stay in contact with everyone that you see on the screen, and that includes Penny, the liaison that couldn't make it tonight because of Mother Nature. So we certainly miss her, but we can certainly understand sometimes technology is not our friend. So thank you for joining us this evening, and have a wonderful day. Most appreciate it. Bye.